Good evening, everyone. My name is Peter Molov. I'm from CAPP, and it's my pleasure to welcome you to this webinar, which is a free informative session about the clinical certificate in dental implantology. So let's dive right in. So first of all, who is with us today? We have Professor Kamis with us on the call, who is the program director of the program, and he's an oromaxillofacial surgeon at the University of Sharjah. We have as well Professor Zahi Badran, who is the program co-director. He's a periodontist at the University of Sharjah, as well as vice dean. And you have as well myself, Peter. I'm from CAPP, and I'll be your host and moderator for today. So what we'll do now is we'll go through a very short presentation, about 15 minutes of what the program entails. What are its benefits, how much does it cost, what is the program structure, etc. And at the end, we'll open it for questions and answers related to the program. You can already ask your questions in the Q&A box. This is open, so please make sure you type any questions you have throughout the presentation. We'll address every single question together with Prof. Zahi and Prof. Kamis at the end of this presentation. So let's begin. As I mentioned, this is a webinar for the clinical certificate in dental implantology. This program is awarded by the University of Sharjah. It is also organized by the University of Sharjah, and CAPP acts as a marketing support as well as a co-organizing program. It starts on the 11th of September, so in about 2.5 months from now, and its duration is about 1 year. So you would realistically finish the program at the September 2027. All of the training, the live patient treatments, the theoretical part, the dummy models, hands-on training, industry-led workshop, etc., all takes place in the University of Sharjah and in the University of Sharjah Hospital, which is very easily accessible from all the different Emirates. If you've not been there, it's a beautiful facility and a beautiful place to be. The program allows maximum of 24 seats, and this is an interview-based program. And last but not least, and this is probably the most important part about this program, that it is NIHS accredited, which is the National Institute for Health Specialists. And you can see the reference number on the top right of your screen of the accreditation that this program has. So let's dive a little bit more into the details of the program. This is a structured pathway into implant dentistry, and basically this program has two main objectives. Number one is to bring you from A to Z into implantology for people that have no experience or very little experience, to be able to go after 1 year in your own clinics and do implant dentistry by yourself without having any support, and do it in a confident way and also in the proper way. Because as we know, there is many ways to do implant dentistry, and the university teaches the right way of how this needs to be done with a scientific backing. Obviously, this program is a live patient treatment program where you will do 30 supervised live implant placements and restorations, and all the patients are provided by the program itself. Prof. Kamis in a while will give you the details about the program, but basically, as I already mentioned, this covers everything from A to Z in implant dentistry. And we already mentioned that this will give you the confidence to do implant dentistry in your own clinic after you graduate from this program. So what makes this program different than other programs? First of all, it is a 1-year program. So this is you can call it's part-time / full-time program, and Prof. Kamis will give you the details of the hours and everything else later. We already mentioned you do 30 implants per participants. There is no sharing, nothing like that. You will yourself do 30 implants placements and restoration, as well as, of course, including the treatment planning and everything related to the implants that you will be doing. And it has 32 sessions across 4 sections. Another thing which is very important, you can already see the price on your screen. There is no hidden cost to this program. This is inclusive of VAT, all the implant kits, the patient, the lab costs, all the certificates, the industry workshop materials, all the coaching that you will receive throughout the program, malpractice insurance, etc. This is one price that has all these components already included in this price. Another very distinct, I would say, and very unique aspect of this program is that you will be using multiple implant systems, namely Straumann, BioHorizon, Nobel Biocare, and Swiss Dental Solutions, which is a ceramic implant system. This is very important. Why? Because this program doesn't receive any financial support from any of these organizations, which means that you will receive a pure scientific based program. And then at the end of the program, you can decide for what kind of implant system you would like to use in your own clinic. So we are not trying to push any product or anything with this program. And this is very, very important when it comes to implant dentistry. And as I already mentioned, this program is NIHS accredited and it fulfills the current requirements for implant dentistry. Many of you maybe ask, what is the National Institute for Health Specialists? And this is a UAE national authority for postgraduate training established by the Federal Cabinet Decree 2014. Which says the national standards for accredited specialist training, including dental implantology. So this is recognized obviously throughout the entire UAE. And I would like to give the word to Prof. Kamis, who will give a little bit more detailed also from the dental side about the program itself. Prof. Kamis, the floor is yours.
Thank you very much, Peter. Good evening, everyone. So let us just take a glance on this program. So this program has multiple components. It has the core didactic knowledge, which is spread over around 20 modules. Most of these didactic modules will take place on Friday. Most of those things will happen on our Clinical and Surgical Training Center, which is well-equipped training center in the University of Sharjah, where a lot of doctors, surgeons, and physicians are trained from all over the country. Then on the same Fridays, some of the days we will have live training on the bench side. So we will have all the fundamental hands-on training like implant placement from the three main suppliers, which we will deal with: Straumann, Nobel Biocare, and BioHorizon, along with another set of workshops on surgical and prosthetic skills, along with other even non-implant modules like photographies and patients' records and surgical skills. Then, along with the didactic, the candidates will be trained to present their cases before the treatment and after the treatment. So we will make sure that all the candidates will be able to present their cases in the license exams without any troubles. So you will be able to present your cases to a multidisciplinary panel, and they'll give you feedback on the plan, and then you will, after the completion of the cases, you'll have some cases presented and we'll give you feedback, and you'll have like a mock exam setting. So that all will enable people to pass their exams smoothly. The industry workshops, they will have, as I told you, we have at least 6, but now we're still receiving like offers from different parties to provide workshops. Those workshops will cover all aspects of implant placement, surgical steps, prosthetic steps in implant placement, digital workflow, and bone densification, etc. As I told you, even other skills like photography, electronic patients recording, case presentations. The main core of the course is lying on the live patient training. So as the program is following the strict rules of the NIHS accreditations. So every candidate will have 30 implants placed on at least 10 patients, okay? And I will show you the breakdown of those cases. So all these clinical sessions will take place on Wednesday and Thursday evening and Sunday all day from the morning till evening. Okay, this will clinical sessions will be directly supervised by a faculty from the program, the registered faculty around 20, so it's almost one-to-one with the core clinicians with the maximum stretch to 1 to 3. So everyone will have the attention of supervisors. These sessions will be populated by a diversity of the faculty. So we will have the oral surgeons, periodontologists, as well as prosthodontists in the floor in all the clinical sessions. So you'll have a multidisciplinary advice and multidisciplinary supervisions, and that make you able to go through most of the procedures. So this is the breakdown of the program, which is 1 year for us. Okay, so it's around 40 weeks of training. Okay, and the total hours of training is 1,280. Now, how this is divided, we have around 40% or less didactic hours, which is like lectures, workshops, and hands-on training. And the main component is on the clinical hours, where you see patients for an assessment, for treatment, follow-up, and execution of all the surgical techniques. So we believe if you go through this intensive funnel, that you will be hopefully at the end self-dependent implantologist by end of these 40 weeks. Okay, this is the breakdown of the cases. Okay, again, we're following the instructions of the NIHS accreditations. You'll have 10 single implants. And why 10? Because you need to place them in various areas. So we'll make sure most of the candidate has to have some implant placed in the anterior maxilla, anterior mandibular area, upper posterior maxilla, and the lower posterior maxilla. So we'll be exposed to all anatomical variations in those multiple isolated implants. Then you'll have about 3 patients with a short span, so where you'll have multiple implants placed and they will be connected through a fixed dental prosthesis. So this will enable the applicants to know how to coordinate the site, select the best site, how to engineer the parallelism, and how to execute the prosthetic component of the implant-supported prosthesis. Then the completely dentaless patients, you need to have 2 implant-supported overdentures, which we believe is one of the most versatile and successful treatment options you can offer to your patients. Okay, so most of the full denture patients now is likely to be converted to implant-supported overdentures, which proven to be one of the very successful even in medically compromised and elderly patients. So I urge everyone to know how to master this. Okay, then you will have 2 full arch fixed dental prosthetic arches. So you'll have all in X cases. So we will take you through different techniques, either axial implants or all-in-4 implants. Okay, so we'll make sure you get exposed to 2 different jaws. Okay, so some for a straightforward for an axial implant, some maybe for all-in-4 or alternatives. So those are the cases. So the cases are not multiplication of number of implants, but it's the diversity of the clinical skills you need to acquire to be able to meet the various patients you see in your practice. Okay, this is how we take you through this journey. Okay, we have a strong panel of professors who will teach you the basics of the anatomy, bone physiology, and biomechanics. Okay, so with this one, we have a lot of senior professors, and which are research. They have research driven impacts. Okay, we have few professors who have even patent in discovery even and making bone grafts. Okay, in the University of Sharjah we have research group where we deal with all the side effects of the materials derived from the bone graft and from the implants. So you will have a very sound fundamental sciences. Okay, then we'll take you through the how you select patients, how you plan, and even I'll take you through the atraumatic extractions. So in this course, definitely will give you a lot of priorities for the immediate implant placement and immediate restorations or provisional restoration placement. Then in the same course, as your skills getting more mature, we will do our best to take you through more complex cases. Although the course is designed by NIHS for very basic things, but as you acquire the basic skills, definitely because of the expertise of the faculty, will take you through more complicated cases where you need to augment and rehabilitate jaws for implants. Then the full arch cases and the aesthetic requirements definitely will have a lot of advances in those training. Plus, we will take you through how you plan a case digitally, how you will construct the guide and use the guide during the surgery. So all these things will be covered with an intensive modules in didactic with the hands-on workshops, as well as you will witness the implementation of all these skills during the more 1,000 clinical hours you'll enjoy during this course. The facility we have a very specialized dedicated implant clinic, okay, which I'm not aware of the presence of this in the other centers. So we have a wing for dental implants, okay, which is not used in any other dentistry. Okay, we have a very specialized radiology center. We have a full access to the panoramic, full CBCT, and our CBCT is like full craniofacial ones. Okay, and then we have a very advanced electronic patients records where you will keep all your records, and that you'll be very easily able to generate your logbook rather than you maintain a paperwork. Okay, the dental units are all well equipped with all the facilities. Now, for implants, we will have all the advanced surgical motors, okay, and what they call the digital workflow. All the rooms are equipped with the right radiological features or facilities. Additionally, the implant system, we are using most of the latest version of from those companies. Okay, like you'll be able to use the latest versions of the implants from Straumann rather than the old traditional ones. So we are getting you exposed to the and we insisted to not to be exclusive to one implant system. Okay, so we will make sure all candidates are exposed equally to all programs in the variety of the cases. So with the single implants, you'll use the 3 system. With the full arch, you'll use multiple systems equally as well. Okay, and the 30 implants we might not stop you at that in case if you have cases where you may exceed the 30 implants. We are prepared, okay, for additional implants as well. Now, one of the unique things about the course, because of our experience in implant training, now I can tell you the College of Dental Medicine has graduated 5 batches of specialists in oral surgery, periodontology, and prosthodontists. All these people were intensively trained in implant dentistry. So we have a very good panel of faculties. Okay, the core faculty, which I mean here, the clinician will be with you in the clinic most of the time. I can assure everyone that the ratio will not exceed 1 to 3. Okay, so you will not find a clinician care about more than 3 students at the same time. And that can go up to 1 to 1 in most of the sessions, because we have more than 20 faculty registered. We have plenty of the faculty from other facilities as well. We got surgeons, prosthodontists, and periodontologists from Abu Dhabi, Dubai, Sharjah, and additionally, we have very few internationally known speakers who will give workshops and online training, and some of them will be hosted even for more didactic and workshop on site as well. Okay, how we will make sure that you reach your targets? This is what we do. Okay, we teach you very well. We give you the foundation training on the bench side. Okay, then once we go to the clinic, we will take you through the things under direct supervision, but we can assure that all of the work will be done by the candidates. But the supervisions will range from direct to indirect visions. As we reach a higher step of entrustment and competency, we will leave you to practice most of the things, okay? And we will just help as required. And then your final cases, we will make sure that you can do them alone. Our presence will be only just to support you. But we will make sure that all of you going through those steps, okay? So I don't expect with the smaller number of implants and other courses we used to have, that some people are not ready even after the course. But with this one, we try to make sure that your final implants will be placed without much of support from our side. Okay, how we will assess you? Okay, we will make sure that this is a training course rather than an academic course. Okay, we run academic courses and we know how to assess students in a complex modules, but in this one, that all based on your performance. So it will be a continuous formative assessment rather than an exam, rather than a multiple choice questions which you answer and I would say, oh, you passed. Okay, so this all will make you be able to answer all the questions in your license exam. So the first stage of assessment will be your direct observation every time. Okay, we will assess you, we'll give you a feedback. Then when you document your case, we will ask you to reflect on your performance in every case, and we give you feedback. We reinforce the good practice, and we will highlight the weaknesses, and we work on that. Then we will improve your presentations skills in how to present the cases. So everyone will be presenting enough cases, okay, and on variety of cases. So if you need to present those cases in the exam, so you'll be able to answer this panel. Of course, all your clinical competency will be judged by your direct observers, okay, plus all your reports with the feedback and comments will be forwarded to a clinical competency committee, which usually they review your performance and they make recommendations. Okay, some people we might be able to help them with an additional sessions. Some people will highlight their performance. So, but the clinical competency committee will make sure that all candidates are ready to practice by end of this program. So your performance will be reviewed almost every 3 months by this committee, which is like a panel of people that revise all your records, all your performance, the diversity of cases you've seen, and the difficulties and challenges that met you during your training.
Prof. Kamis, thank you very much for your very thorough explanation of the program. Now we'll go into the last slide of the presentation before we open it for Q&A. In terms of the fees and admissions, you can see the amount on your screen and also the installments and how it all works. As we already mentioned, this is all-inclusive price. There is not a single extra dirham that you would need to pay. And like Prof. Kamis already mentioned, even if you have to place extra implants, this already would be also covered. There is no extra money asked for extra implants, lab fees, etc. So who can apply for this program? Obviously, you need to have a recognized dental degree. You also need to have a minimum of 3-year post-internship experience. However, there is a potential that there is an exemption for this. We need to get an exemption from the NIHS for the same. So if you do have less than 3 years of post-internship experience, you could still apply, and that will be reviewed on a case-by-case basis. The third document that you need to have is a valid dental practitioner's license and a few other small documents such as transcript of bachelor degree records, reference letter, CV, passport copy, etc. How can you apply and what's the process? So obviously you can get in touch with CAPP and we'll give you our contact details. Or if you're ready, you can submit your application to events@cappmail.com. You will have a very brief online admissions interview, and this interview is just to get to know you and also ask any questions that you might have directly to the faculty. Anything related to the schedule, etc. Then you will have a conditional offer letter, and then of course you're enrolled into the program. But even if you're not sure if you wish to join the program, we suggest that at least you try to enroll because there is no payment required. It's required only after all this process is completely done. So if you're thinking of doing it, we suggest at least that you try and apply. Please feel free to get in touch with CAPP if you have any further questions or anything comes to your mind later in the evening. We wish you a very good evening, and until we meet again, thank you so much and have a good evening.